In the midst of one of the most celebrated festivals around the world, there's concern we'll see another surge of COVID-19 across this country. The South Asian festival of Diwali has long been a worry for health experts here. The areas that host the biggest celebrations in Canada happen to be among the worst hit by COVID-19. As Mike Drolet reports, leading experts say the cultural connection thought to protect these communities may be the ones that hurt them.
There's nothing subtle about Diwali. It's big, bright, and crowded. And to celebrate in Canada, the hotspots are always Surrey, BC, and Brampton, Ontario, which coincidentally are the areas most responsible for feeding COVID-19 growth in their respective provinces. To say Brampton officials were worried would be an understatement. They pleaded for restraint, and for the most part, that's what they got. The Toronto suburb has over 100 places of worship, yet police were called to only one, where roughly 300 people had gathered in a parking lot.
The lineup was too big, but they were cooperative. They worked with bylaw and Peel Police to disperse the crowd. They shut down on their own.
Only one ticket was issued, leaving officers time to crack down on illegal fireworks. The concern about large gatherings is well-founded. Last week, Peel region, which includes Brampton, saw its positivity rate hit 10%. And that's not a coincidence, according to two infectious disease specialists who say their community is defined by a culture of large gatherings, multi-generational households, and jobs that are often essential services.
You sometimes have up to 10, 12, sometimes even 14 people living under one roof. Even if you're following all the rules, it's very difficult to isolate in these circumstances. That acts as an amplifying type of feature.
In fact, while South Asians account for about a third of the population of Peel, they also account for nearly half of its COVID-19 cases.
There are particular needs to this community. It is driving a lot of what we see in some of our hotspots in British Columbia and Ontario.
One of the biggest issues is where to quarantine. It's just impossible with big households. Ontario health officials seem to have clued into that and are now setting up a quarantine hotel to get positive cases out of their homes.
Finally, we're starting to get some help. We got 2 new testing centers from the province. We got 70 new staff from the province for Peel Public Health for case management and case trackers.
It's a start, but will it be enough to flatten the surging wave of COVID cases? Mike Drolet, Global News, Toronto.
Here's a look at the pandemic situation across the country. BC is not reporting today, but there were 991 recorded in Alberta. Saskatchewan reported 181 new cases. Manitoba broke its daily record with 494 new cases. Ontario and Quebec are both reporting over 1,000 new cases. There were 10 new infections reported in Nunavut. Before today, there had been just 8 cases in total in the territory since the start of the pandemic. And there are new cases cropping up in Atlantic Canada, 3 in New Brunswick, 2 in Nova Scotia, and 2 in Newfoundland and Labrador.